Dr. Zolti, and I'd like to talk to you a bit about obstructive sleep apnea. Now, there are two types of sleep apnea. The first one is obstructive that we're going to talk about, and there's another one called central, and if necessary, I'll chat to you later about it. Obstructive sleep apnea is a common disorder that affects men and women, and more commonly as we get older, it tends to be more prevalent and more severe. What happens is, as you sleep, your body relaxes, and as it relaxes, your throat can partially or completely obstruct the airway by collapsing. And many times that's not a problem, but in some people it causes snoring, and if it occurs a little bit more, it can even cause partial obstruction of the airway. For example, your brain, which is monitoring the effort to breathe, may note that this is occurring and arouse or wake up, even though you're not aware of it. So, as an example, as you're sleeping, you may have this mild kind of obstruction, and your brain may wake up. You may not wake up, but your brain may, and then you may fall asleep again, and that can happen over and over again. A complete obstruction would look something like this, and your bed partner may consider that you're holding your breath. For example, you may sleep and then you may make those efforts, but because of the obstruction, you're not able to take a breath. Well, this repetitive event that occurs during the night can result in some long-term problems. The obvious one is that it fragments your sleep and can make you wake up in the morning and still feel tired and not feel as if you had a good night, even though you're not aware of all the times that your brain woke up. Another possibility, apart from an angry bed partner, is that your oxygen may drop while you sleep, and that over a period of time can result in long-term effects. And these effects include cognitive dysfunction or thinking issues, memory, etc. It may result and is an independent risk factor for strokes. It can result in vascular disease of these major vessels called the carotids. It's a risk factor for heart disease such as heart attacks and irregular heartbeats. And in many people, when your body gets that fright in the middle of the night, it can precipitate an irregular heartbeat. So some people have a thing called atrial fibrillation. And in those cases, the sudden arousal may precipitate and bring the person back into that abnormal rhythm. It's also implicated in erectile dysfunction, depression. Many of the symptoms of fatigue are very similar to those of depression. And in fact, when people with depression are treated with sleep apnea, if they have it, a large proportion of them actually improve. And then it's implicated in poor control of diabetes. If someone has renal problems or kidney problems, it can actually result in a hastening of the renal disease. And it also makes it more difficult to lose weight if that's something you're trying to do. Anyway, as you can see, there's a lot of information. And I can talk to you a bit about the treatment, which includes a CPAP device, amongst others, and there are many options. And just as a message, don't take other people's experience to supplant yours. In other words, if someone else had a bad experience with CPAP, don't make that true for you, because often it depends on the interaction with our group, and hopefully we can work with you if there are any issues to overcome that. But by far the majority of people actually use the machine or are happy with it. Anyway, there's this machine that one puts on the nose or the nose and mouth, and this machine delivers air pressure to keep the throat open. But let me tell you more when I see you in a few minutes. See you again.